For all verified facts, subscribe to our YouTube channel and click the bell icon to get the latest updates.
Painting is how bariatric surgeon Dr. Aparna deals with the stress and pain of watching her colleagues grapple with an unknown disease and even die of it in the process of healing others.
All these paintings come straight from the heart. What we've been seeing, at least in the medical circles, is that we hear about at least one doctor passing away almost every day. This is a doctor who's passed out from Datta Mekhi Institute in Savangi, Wardha, and she was 32 years old and 7 months pregnant, and she passed away due to COVID-19 infection.
At the same time, there is this. When answering a question in the Lok Sabha, the Minister of State for Health and Family Welfare, Ashwini Kumar Chaubey, said no records have been maintained for the deaths of doctors who had died in the line of duty.
There is no amount of compensation that can really compensate the loss of life of a doctor or anyone for that matter. So I think there is a deep sadness that all of us feel, and when our healthcare minister actually says that they don't even have any data on the number of doctors who've lost their lives, I think it hurts quite a lot because that just shows that the government is not even bothered about what is happening to doctors.
Taking a strong exception to the government's indifference and the lack of data on the deaths of doctors, the Indian Medical Association, the umbrella body of allopathic doctors, put out a list of 515 doctors who they say died due to COVID-19. They demand that they be treated as martyrs.
There was an incident where this doctor who ran a COVID hospital and served COVID patients, he lost his own life to COVID and he was not even allowed a decent burial. And another doctor who was his friend, who had to drive the ambulance himself, he was beaten up because the people did not want this doctor to be buried in that graveyard. So somehow he managed and he dug the grave by himself. I mean, nobody even came forward to help him to dig the grave. So it was an extremely sad incident, and I think these are things which are extremely demotivating, and there is a lot of dejection in the medical fraternity today. And I don't know, I mean, people in the future generations, I really would wonder what would motivate them to, take up medicine as a career.
The pandemic has put everyone under extreme mental stress, especially frontline health workers and doctors who deal with death and disease on an everyday basis.
The concern really is because a lot of the stress for the healthcare professionals actually comes out of factors that are out of their control. Things that we call systemic and structural issues that lead to stress. For nurses, for example, the stress might come out of the fact that they have to deal with irate relatives, and that's true for doctors also. If you talk to healthcare professionals, they'll tell you that managing a patient and handling all the emergencies medically is not what causes stress. What causes stress are all these non-medical issues which are definitely not under their control and are under the control of the healthcare system. Problem has been when they've offered to work, then you not actually handled them well or treated them with the dignity and the respect that is required of the people who are battling it at the front line.
What healthcare professionals need is not the showering of petals or banging plates in their honor. They need dignity, not stigma. They need facilities and infrastructure, not empty promises. And they need to be counted.